Hey guys, what's up? It's Danny. In today's video, I'm going to be interviewing my friend Alex Rodriguez, who is both an athletic trainer and a licensed physical therapist. We're going to be talking about the differences and similarities between athletic training and physical therapy so you can see which one is a better fit for you.
How's it going, Danny? Long time no see.
I know, long time no see. Everything good?
Yeah, everything's great. You know
All
me,
right.
just working, helping patients out, the usual stuff.
Yeah, no, that's good to hear. I was just telling the viewers that we're going to do an interview today about the differences between athletic training and physical therapy. And obviously, since you are both, I want to interview you. So, are you ready?
Yeah, let's do it. Let's
Yeah,
go.
so the first thing that I kind of want to go over, because people are probably saying, "Oh, Danny, how do you and Alex know each other?" You know, we both have UM here on right now. So just so you guys know, when I think I was a sophomore at UM, Alex was a senior. And the way we met was actually pretty funny. We had to share a room together for an athletic training convention. We really didn't know each other at all. We never spoken. And we ended up together in the same room. And I actually think we ended up sharing beds, right?
Yeah, that's true. Yeah,
Yeah.
it was four of us in one room, all AT students, but it was a good way to just bond and get to know each
No,
other.
exactly. Yeah, I agree. I mean, so yeah, that's kind of how me and Alex know each other through athletic training. As a lot of you guys know, I majored in athletic training at the University of Miami. Alex also majored in athletic training. He was two cohorts above me. However, he decided to continue his education and do physical therapy. So, Alex, I know you did physical therapy. So, why don't you just tell me like a little bit about your background? Why did you initially decide to do athletic training as an undergrad major and then go into PT later on?
Yeah, so back in high school, I always knew I wanted to do something with sports medicine. I always found myself to be an athlete, or at least competitive. I wrestled, I played soccer, did mixed martial arts, all types of sports. And I never was the best one on the team, but I always was passionate about the injuries and kind of just understanding the anatomy and the biomechanics that come with movement. So I had this idea that, hey, I'll be a doctor. I'll go into sports medicine. Back in high school, that was my thought. And once I graduated, I went to community college for a little over 2 years. And at that time, I was really trying to figure out what do I want to do, what do I want to transfer into, and I was looking at different programs. And the University of Miami was one that I was interested in. At the time, I was living in San Jose, California, where I currently live now, and I wanted to go somewhere far. I wanted to get the whole college experience. So I thought, why not just go to the opposite coast? So I went as far as possible, and I applied to University of Miami, got in, and I was in a 3-year program for athletic training. So in a way, it kind of set me back because I was technically a sophomore, even though I had credits that would put me at it as a junior. But it worked out. Um, while I was there, I didn't know if I wanted to go into sports medicine as a physician or if I wanted to do the athletic training. But I sat for one um, pre medicine meeting, and once I found out all the requirements, I said, yeah, this is going to take too long. So I just chose athletic training. But I really enjoyed it. It was a good experience of working with the football team, working with the basketball team, volleyball, track, women's soccer, just about everything. And each rotation that I was in was roughly about 8 weeks. It was a good experience. I mean, I got to really just see different injuries and work with different athletes and different positions and other students that were passionate about sports medicine. But after doing more research, I had doubts. I thought that maybe this isn't for me in the sense that I do want to have something sustainable. I live in the Bay Area now. So
Hmm.
as an athletic trainer, the salaries aren't great. And I was passionate about the rehab. So I did an internship for, I guess more volunteering because I did it during a summer break, and I volunteered at a PT clinic, and everything was similar. The rehab, the injuries, it was just all great. And I thought, hey, like I'm doing this now, why don't I just go into physical therapy? And it's already going to be pretty similar. So that's what I did. I got my hours. I applied to PT school, and after about a year of applying, I finally got in, and I decided to stay at the University of Miami. I just felt like it was the best option for me since I wouldn't have to restart, and I was already familiar with what I had to do. Being in Miami.
Yeah, no, I know you kind of mentioned that transition of going from athletic training to physical therapy. And for a lot of people watching this, the way that athletic training used to work is that it was a bachelor's degree. So I know I'm pretty sure that you did this. So while getting your bachelor's in athletic training, you fulfilled the prereqs for PT school. And then probably at the end of your bachelor's, maybe when you were a senior, you applied to PT school and then you got in. Is that correct? That's how it worked?
Yeah, that's correct. So previously, you were able to get an athletic training degree as an undergraduate, but it's transitioned to a master's program now. So I was one of the last classes that was able to get a bachelor's degree in athletic training. And what I did is I just went straight into PT school, and I did contemplate maybe just working for a year and getting more experience in the field. But luckily, I got in, and I think it just really helped me stay motivated and just get it done ultimately. Because I've always been somebody that if I have a goal, I just want to do it. I want to just accomplish it. And what better way than to just go right into it? So I got 10 days off after I graduated with my bachelor's, and I went straight into a graduate program. So not much of a break, but wouldn't change it. I think it was best for me since everything was fresh.
Yeah, I think when athletic training used to be a bachelor's, that was like I said, it was something very common. So that's why you'll see a lot of people in physical therapy. They'll have the credential like DPT, ATC because they're dual credential. But now, and we'll talk about this later. It's kind of harder to do that with the masters. I don't think it's going to be as common. But yeah, that's why you see that. That's a very common, to have both because you're pretty much dual certified. You're certified as an athletic trainer and you're certified as a physical therapist, and that kind of just broadens, your horizons in terms of jobs where you can work, your knowledge. So that's something very good that you did for yourself.
Definitely. Yeah, it helps out in those cases where maybe you have a higher level athlete or somebody that really just wants to go back into playing sports. So I find it very helpful in bridging the gap because we don't have to refer out as an AT and as a PT because you kind of have a good understanding of what's required of certain sports, and it just makes you a little bit more of an expert in that field.
Yeah, no, for sure. Now let's get into, the chunk of this video because this is the reason a lot of people, oh, I like your cats in the background, by the way. But this is the reason a lot of people are watching this video, and people have asked me personally. I'm pretty sure people have asked you. And let's just talk about the main differences between athletic training and physical therapy. I'll say it again. The main differences between athletic training and physical therapy, or the main difference between an athletic trainer and a physical therapist. Because a lot of people who get into sports medicine or they like sports, they're really curious. They don't really know what athletic training is. They don't really know what physical therapy is. So I think if we educate them, that could give them a good idea of what, something potentially that they might get into. So first, let's talk about the educational requirements. I'll talk about the athletic training sides of things. Like me and Alex have been saying before, it was just an undergraduate degree. The most common thing a lot of athletic trainers would do is that they would get their bachelor's degree in athletic training, then get a master's in either athletic training or something related, and they would do it under a GA position, which is a graduate assistant position. That way, they were getting experience in the training room for a college usually, and also getting a master's degree at the same time. That was very common. Then after that, they would go straight into employment. Now the way it works is that with athletic training, it's a master's program. So what a lot of people are doing is they're getting an undergraduate degree in physical education, kinesiology, something sports science related, and then applying to a master's of athletic training program. And during that program, like at the end of it, they take the BOC exam. And once you take the BOC exam, you become board certified. Then you get your license depending on the state. But now, like I said, it is a master's, whereas before it was traditionally a bachelor's. And for physical therapy, you have to go to physical therapy school. So Alex, tell us more about that process.
Yeah, so with physical therapy school, it used to be a bachelor's program back in the late 80s and 90s, and then it transitioned into a master's program. And around the mid 2000s, that's when it transitioned to a doctorate program. So that's where we are now. And it's typically about 3 years of schooling. So for my school, it was about 2 years of didactic lecture work. So that's where you're sitting in a classroom and you're learning and you're getting your practice, your repetitions with different classes, including like gait training, acute skills. You're learning about the musculoskeletal system, orthopedic skills, a little bit of everything. It kind of just helps to make sure that you're a good general physical therapist, so that when you graduate, you're skilled in the basic knowledge of what to do. But when you really learn the most is when you go off to your internships, which for me were about 8 weeks in total for each one. I had four total internships, so it amounted to about 32 weeks. They weren't all at the same time. My first one was about a little over a year after my first year of PT school. And then the last three were the last year. So that's really when you get into the groove of things. You're practicing your hands-on skills. You're interacting with patients. You're practicing everything you learn. You pick up things that you learn along the road from like other clinicians. And yeah, a lot of it, like I said previously, is similar to athletic training, except that in this setting as a physical therapist, you're typically working more with like post-op cases, depending on where you're at. But for me, it was like mostly orthopedic. You get a lot of post-op cases. So like coming off of surgery, whether it's for like a total knee, total shoulder, ankle sprains, a carpal tunnel syndrome, things like that. But yeah, you get to really just pick which types of internships you would like to go from. For me, I always had an interest in orthopedics and sports, so I tried to make it similar to that. But there was a requirement for a hospital acute care setting. So that was also 8 weeks, and it kind of just reinsured I didn't want to work in the hospital, but it was a good experience nonetheless. And yeah, usually it's a little bit longer of a program compared to the athletic training program. So like I said, it's 3 years for a PT program. For athletic training, typically it's about 2 years right now as a master's program. But
Yeah.
some PT programs are a little bit less. I heard that some are between 2 to 3 years, so they can be a little bit more accelerated.
Yeah, I think there's also like obviously one is for physical therapy, one is for athletic training, but kind of like you mentioned about the clinical side of things, both of them do have a clinical component. Even if you decide to do athletic training, you still have rotations going on while you're taking classes. So it's not just like you're like just learning in the classroom and that's it. You know, you have your rotations going on, you have your classes going on, and you just have to know how to kind of like balance it out, you know, to make the best out of it.
Definitely, I'm glad you mentioned that because with athletic training, when I was in undergraduate studies, I typically would wake up really early, sometimes 5:30, 6, 7 if I'm lucky. And what I would do is I would go to, for example, football practice. We would set up the field, get the players taped up, get everything ready for practice. And then usually around 11:30, maybe 12 at the latest, we're cleaning everything up and then going to class. And after classes, you're exhausted. Sometimes you go back to rotation to get your hours, and there's certain requirements that you have to fulfill. And for me, I was working also, so I was pretty busy all day. But that's just the grind that comes with athletic training. You really have to be all in, otherwise it's going to be hard to accomplish the goals and the requirements of the AT program. With PT school, I found this more beneficial for me because I was able to have a little bit more work-life balance. You go off to internships, your clinicals, and typically you're just working. You're working for free essentially, but you are gaining valuable skills, and you don't have to worry about any classwork, any essays. You do have some busy work here and there, but ultimately it's nothing too bad. And depending on the rotation, you're off at like 3 or 4 sometimes. Sometimes later, but it's pretty much a full-time, like 40-hour work job, and it's a little bit more sustainable in my opinion, just from my experience.
Yeah, no, I can imagine. I remember working football, and like you said, there's those days when you wake up at 5, sometimes even, I think the earliest I woke up for football was at 3 a.m. And it's like you're tired, they make you, you know, carry water, do a lot of, as they call it, scut work. So it's good to hear that in physical therapy, you know, you don't really kind of do that type of stuff, maybe not as much. So that's good to hear. But you know, now we know about the educational side of it. We know how, you know, we can become an athletic trainer or physical therapy. But let's talk about some of the responsibilities specifically that athletic trainers and physical therapists have. I'll start first with athletic trainers. So something that I think it's kind of a big difference between athletic training and physical therapy is that athletic trainers are first responders. So they're the ones that when an injury happens, they are running on the field with their kit, their AED, and making sure that the athlete is doing well. I know a lot of you guys might watch sports, football, whatever it may be. I'm pretty sure when an injury happens, you guys notice it. Somebody's running on the field. Usually it's the athletic trainer that does that because that's kind of the skill set that they have. They're ready to respond to emergencies. They also do something called an emergency action plan, which is it does have an educational component, but as the name implies, it's pretty much a plan where they decide who kind of has the roles during an emergency. So let's say there's an emergency in a really big NFL stadium. Usually the head athletic trainer is the one who decides even prior to that emergency how they're going to carry out the emergency. So usually before the season starts, the head athletic trainer will meet with their staff, with the team physicians, with other sports medicine personnel, and they will say, okay, if an emergency were to happen, this is where the ambulance is going to come from. This is who is responsible for the following roles. So usually the head athletic trainer will say, okay, I'll be on the field, while the assistants might stay on the sideline. They'll also say, okay, the physicians are going to come with me. So they also have that responsibility of kind of educating the sports medicine staff about who's going to do what, and also explaining it to the coaches as well so they could be aware. And that's really important at like a high school level where there's not, where there isn't really a team physician or they don't have a lot of sports medicine staff. So it's kind of on the athletic trainer to educate not only the athletes but the coaches about player safety. Like I said, they provide first aid and emergent care. They also develop and carry out rehab programs for injured and non-injured athletes. Something that I think has been very emphasized nowadays is kind of the idea of prehab. So it's protecting an athlete and preventing an injury before the injury even starts. So a lot of time the athletes will go into the training room and they'll get their ankles taped, or they might, get a massage, they might get some type of modality done on them. That way when they practice or they play a game, they have less chances of getting injured, and usually the people performing that are the athletic trainers, whether it's in a college setting or a high school setting. Something else that they do is practice under the direction of a physician, and they collaborate with the medical team. Like I said, and this is actually a quote that is said by a lot of people in the athletic training community. Athletic trainers are a jack of all trades. They kind of do it all within the sports medicine team. They delineate roles. They carry out treatments. They respond in the emergencies, and since they are the jack of all trades, they kind of are the bridge between the physician and the coaches, the physician and the PTs. I know that athletic trainers might assess something on the scene, but then they tell the doctor about it, and then they tell the physical therapist about it. They're like, oh, this is what I saw, you should make a good plan to rehab. So they kind of serve as like the triage personnel within the sports medicine team. And something else that they do is participate in continuing education annually to maintain credentials and stay up to date with educational requirements. Just like any profession, athletic training is constantly evolving and new things are happening. So CEUs are something that you have to do to stay not only certified but licensed as well. I believe it's 50 CEUs every 2 years. So you have to get those done as an athletic trainer just to keep learning and keep expanding your clinical skill set. So Alex, tell me, what are the main responsibilities as a physical therapist?
Yeah, so some of the responsibilities for a physical therapist include evaluating and diagnosing different movement disorders. So as physical therapists, we're considered the movement specialist, which is great because, like I mentioned previously, I always had an interest in biomechanics, and that's something that physical therapists really harp on. How are you moving, and how do we improve the way that you're moving if you're not moving the way you should? So as a physical therapist, our job is to provide rehab techniques and also just bring the patient back to their prior level of function or as close as possible. We utilize different techniques such as manual therapy, neuromuscular reeducation, therapeutic exercise, therapeutic activity, gait training, and we also fit patients for assistive devices such as canes, walkers, crutches. And I think most importantly, we educate the patient, and we're really there sometimes as coaches to uplift our patients and give them hope of getting back to where they were. There's times where maybe I'm working with a patient and they don't come in with the best mindset because their doctor told them that their knee is bone on bone. So that sounds horrible, but if you think about what that truly is, it's not that serious in the sense that everybody will get it at some time, that everybody develops that bone on bone, that arthritis that comes with age. It's common, but it's all the physiological factors that come with it that are really producing that pain. It's not that your knees are bone on bone. It's all the things that come with it. So sometimes patients come in very fearful the first time getting physical therapy, so they don't really know what to expect. And like I said, like we're there as their coaches. We're there to really just help them become educated on what they need to do while still providing some hands-on techniques and other types of exercises, and gait training to get them back to where they should be and want to be. Sometimes physical therapists can work in different settings. So for me, I work in an outpatient orthopedic setting. Some physical therapists work with sports, so they work directly with athletic trainers and other physicians. So that's where it can kind of, I guess, intertwine with the responsibilities of what you should do. There's certain roles that an athletic trainer will do versus what a physical therapist will do, in terms of like the athletic trainer will be the first responder and a physical therapist will be there to assist, but they're really more in the background of like the rehab. They help the patients get better behind the scenes. So if somebody is coming off of a high ankle sprain, then maybe it's best to work with a physical therapist, because then they're going to have more time to dedicate to them. They can really emphasize their rehab program. And there's also CE requirements that are included as well. So you have to get a certain amount every 2 years. I believe it's 30. But yeah, it's something that's required in order to continue to be licensed and to continue to practice as a physical therapist.
Yeah, no, like you mentioned, especially with like the first responder thing, I think a big takeaway that people who are watching this should know is that athletic training is much more like, I guess, not action packed, but like more like if something bad happens on the field, like you run, to the patient or the athlete. It's more like yeah, that's kind of the best way to put it. It's more like they're the first responders, they're the first ones to see it, but then PTs are kind of more on the rehab side of things. They, like you've mentioned, they focus more on movement, mobility, range of motion, where the athletic trainer also has that knowledge, just obviously not as in depth compared to a physical therapist. So the athletic trainer might do initial rehab, they might get initial measurements and stuff like that. But then if they see that patient is not, doing as well or something's lacking, they go to a physical therapist, and the physical therapist will usually have a better plan, and a plan that fits specifically to that patient. And kind of with the settings with athletic training, athletic trainers really are all over the place. And I think that's something people really don't know, because people think that athletic trainers just work with sports teams, whether it's collegiate or professional, which they do. And I think it's funny because a lot of people go into athletic training, I know personally I did, wanting to work in the sports setting, but I think people don't know the amount of hours and commitment that it really takes to work in sports. A lot of people go into the profession being excited to work football, and then they work football for like 2 weeks and they're like, I'm never doing this again. Because guys, like it does take a lot of time. And it is, like we said, us as students, we were waking up at 4 or 5 in the morning. And that was as students. The people who are full-time, they woke up even earlier. So, before you get into athletic training, just because you like sports, there's a lot more to it in the sports world. But luckily, there's other places where athletic trainers can work, like fitness centers. Something that's becoming more unique nowadays is that you're seeing athletic trainers working in settings like performing arts, they'll help dancers, people that do ballet, like that type of stuff, acrobatics. You also have athletic trainers working in the military, and some of them are actually stationed in naval bases. I know sometimes athletic trainers, especially when it was in like an undergrad degree, they would like go to the army and then become an athletic trainer and then become like an army athletic trainer. I know that was common if you want to be in that specific setting. Athletic trainers also work in hospitals. I'm currently an athletic trainer at a hospital. Pretty much we just help out the physicians when it comes to doing the evals. We also educate the patients. We kind of help with the whole entire flow of the clinic. Very different to when it comes working with sports. Like I'm never at the hospital, I'm never really running, or I'm never in a rush to see a patient. It's a more calm and passive setting. And then athletic trainers also work at PT clinics alongside the physical therapists, and sometimes the way, at least from what I've seen, you could correct me if if you've seen it differently. But when I had a rotation at a physical therapy clinic as an athletic training student, usually it was kind of like the physical therapist was overseeing everything, and then the athletic trainers were like carrying out the specific treatment that the physical therapist asked from them. So I think that is kind of where the knowledge kind of intercepts and comes together, because the physical therapist has a deeper understanding. They kind of have a personalized plan, but the athletic trainer can carry it out as well. When it comes to doing modalities, stretching, therapeutic exercises, they can do all that if a physical therapist tells them, well, like, what to do in the PT clinic setting. Is there any other setting, or any, like I mentioned, there's unique settings with athletic training, especially when it comes to performing arts. Is there like a place where PTs may be able to work that people aren't really aware about?
Yeah, so I think most commonly people see physical therapy in the settings in the hospital or maybe like an outpatient PT clinic. Those are typically what we see. And then we also obviously work in the sports settings, but there's other settings that people may not know about. So, for example, if someone has a stroke, the usual best option to go to is to go into neuro rehab. It's a little bit more intensive. You're getting more care, you're getting more treatment time, and every day that passes by, it's a new opportunity to develop concepts like neuroplasticity, which just means that it's the ability to learn new skills or relearn them if you learned them previously. And it's something that you can utilize for more severe cases that are neurological. But there's also acute care settings, which maybe are more for like traumatic incidents. So if you were in a car accident, or if you were, I don't know, for anything more traumatic. So anything that requires you to be in the hospital, that requires intensive care, you'll be there. You'll be seen by an acute care PT. But there's also cardiac settings, which are more for like heart diseases. There's pelvic floor for people that maybe having some incontinence, or for women that are postpartum. And there's also amputee settings. So after maybe after amputating a knee or a lower leg or an arm, you're able to go into PT, and you'll learn how to walk again with maybe a prosthesis, or how to how to use your hook if you have a prosthesis for the arm. But yeah, it's one of those settings where you can do a lot, and you're able to help different populations, and ultimately you're working with different people almost every day. And insurance usually is what's going to allow patients to be seen for treatment. I've had patients that are only authorized maybe 6 visits. I've had patients that have great insurance. Like, I've been treating them for over a year, and insurance doesn't really give them any hassle in terms of how many visits they can get. But usually there is a limit once skilled PT is not considered medically necessary.
Yeah, and I think it's important to note with the insurance thing. I know that in athletic training, there's always been a big issue, because I don't think I know that athletic trainers legally like can't bill, which is why really you don't see like athletic training clinics, because they just wouldn't be financially sustainable. And I know with physical therapy, you can bill, correct? You can bill the insurance.
Correct. Every time you have a patient come in, you're billing for something, whether it's the evaluation, or if you did any hands-on treatment. So I've had patients where they come in and they don't feel too great, and I might not bill for anything at that point, because they just didn't feel. I didn't find it necessary to give them skilled treatment. I kind of referred them out. I told them to go home and get some rest. But yeah, most times I am billing for something. But there are there are situations where patients maybe don't have insurance, or they're okay with doing cash pay. And then there's a specific number that maybe a patient will be willing to pay for your services. Evaluations are typically a little bit more expensive, but every follow-up visit afterwards is a set fee. And it just depends on what your situation is, because sometimes you can afford it, other times maybe you just let insurance do its thing, and you'll see how many visits you can get ultimately.
Yeah, no. And so we talked about billing and stuff like that. So kind of going into the financial side of both professions. So the cost of schooling is usually, it's a little bit less expensive than physical therapy programs. That kind of makes sense. Athletic training is like a master's degree, while physical therapy is seen as a doctorate. So that's considered, it's considered higher education, so which makes it more expensive, would you say?
I would agree. I think now that the athletic training program is a master's program, hopefully this helps boost up the salary, the average salary that I've seen and heard of. But there is a big discrepancy in terms of pay. And like I said in the beginning of the video, going into PT school was something that I found being very similar to athletic training, but from a financial standpoint, I just thought it would be a better option for me because once you go to school, you do have student loans, and I just didn't see how that would be financially possible. But on top of that, it's also more sustainable for me as an adult. I work 8 to 7, 3 days a week, and then 1 day a week I'm off at like 12 or 1 p.m. So it's pretty balanced. With athletic training, you can definitely expect to dedicate more time in the training room or whichever setting you're in. And sometimes when you're working with a sports team, you can you can kiss your vacations goodbye because you're pretty much with the team maybe
Yeah.
10 months out of the year, depending on what sport you're in. But that's something to be aware of, that when you want to go the route of going into a sports team, you are making a big sacrifice. Some people really enjoy it. Some people get burnt out. It really just depends. That's why I think it's great to have internships and talk to different people and different resources to see what's best for you. But ultimately, you have to just get your feet wet and, volunteer, talk to people and see if it's right for you. Because if you just go into either setting without really doing your research, it's a big financial burden down the road because you want to be all in and hopefully you don't really regret it toward the end. I did have some classmates, both in athletic training and in physical therapy school, that found those career choices to not be the best option for them. So they didn't end up finishing. I think it's better to do it early on than later in the program, but some people don't really know what they want or what they expect. So like I said, just get your volunteering in and get that experience one way or another because it's best to just see it for yourself.
Yeah, no, like you mentioned with athletic training, and from our experiences, I also like I think that it's like not a secret. I read these like Reddit forums. You talk to athletic trainers, and everybody knows that with athletic training there is a really high turnover rate. Usually, a lot of athletic trainers that work at colleges and universities only last maybe 2 or 3 years, 4 or 5 maximum, because the salaries are just really low, and they're not only low, but you're working excessive hours I personally would say that after, doing my internship with athletics, I told myself I would never work in college athletics as an athletic trainer. And I'm just being honest, that's just not for me. I am a guy who I value my lifestyle. I like to work out in the mornings. I like to do stuff on the weekends. And when you're an athletic trainer at college, reality is that you kind of don't have control over your life. It's the coaches, the athletic directors, you have staff on top of you. And I mean, like you mentioned, some people do love that. There are people who they just want to do sports, sports, sports. They love athletics. They like to travel a lot. They like being in that zone. I thought I was going to be one of those people, which is why my initial goal was, I want to be an athletic trainer for a sports team. But once I actually, like you said, step your foot in the waters, I'm like, hey, I don't want that lifestyle anymore. So I think it is important for people kind of to go in with an open mind and, really explore and see what they like, what they don't like. I will say that now that I do work in a hospital and, talking about the athletic trainers and the low salaries, which is kind of an issue across the board, is that now working in a hospital, you're seeing all these different professions, PAs, physicians, and, especially I know a lot of people, if they don't do, after athletic training, if they don't do PT, a lot of them do PA. Because it's not like exactly the same, but it's pretty similar in terms of what you're doing day to day. PAs obviously have more expertise, they have more rules, more responsibilities and stuff like that. But it's just 2 extra years of school to do a job that pays you almost double the amount. And that's why a lot of people will do athletic training and then physical therapy. According to the labor statistics, the Bureau of Labor Statistics, the average salary for an athletic trainer is $49,000, and for a physical therapist, it's $96,000. So yes, it's more schooling, but at the end of the day, you're getting paid more. And since you're getting paid more, your hours can be a little bit better depending on what, what location or what field you decide to be in, what type of establishment. But I think that's something to note for people that are going into athletic training specifically, is just to really understand what you're getting yourself into. Because especially sports, it is a lot harder than what people think.
Yeah, I agree. You have to be willing to work hard and be in uncomfortable situations, because ultimately you're going to have to, have some sleepless nights or have some days where you just feel like you have to carry on. But if you're passionate about it, it's all worth it in the end because it pays off. And once you get those letters after your name, it really makes you feel impactful that you can make someone's life better, whether it's on the field, in a clinic, whatever the case may be. It really just makes you feel like you have the power to make somebody have hope or get better. And some people need that extra hand, and that's where we fit in as athletic trainers and PTs. We're experienced, and we just have that ability to make outcomes possible.
Yeah, so Alex, I'm gonna ask you this question. This is kind of a curveball question, all right? I didn't really ask you this before the interview, but let's say right now, because a lot of people that might be watching this, they're in high school or they might just be starting college. Let's say somebody goes to you, oh, like, why should I do athletic training? Or why should I do physical therapy? What answers would you give them? Like, why should someone do athletic training or why should somebody do physical therapy?
Yeah, so that's a good question. So it really just depends. If you're somebody that is willing to put in the time and the sacrifices, and you're passionate about being in the sports settings, or you're really just passionate about being a first responder and seeing all the action up close, then athletic training might be a good option for you. We talked about all the different settings that you can go into: performing arts, military, fitness centers, hospitals, sports. But what people really think about is getting that first like hands-on experience, like when you're there as that first medical professional. You have to be willing to, like I said, put in the time and the work and balance school and clinical work at the same time, but it's all worth it. And I think, at least for my program at the University of Miami, they did a good job of making it making the coursework replicable to what we were learning during our internship. So if we were learning about the foot, sometimes I'd be working with like a lower body sport like soccer. So it really just made sense. And then on top of that, you're getting the practical skills in class also. So it's very well structured. For PT school, you get all this information at once, but you don't really have your first internship until maybe a year later. So then that's where it gets difficult, because it's like, oh, okay, I know all this information. I need to do X, Y, and Z in order to get through my evaluation. From my personal experience, you don't always use what you learn in the classroom, but at the same time, you can use these things in your toolbox. So maybe you go back into looking at special tests. Maybe you go back into your textbooks about orthopedic skills. Maybe you have someone coming in with a hand injury and you don't really get as many hands. Well, technically, we are skilled. We're healthcare providers. We're doctors of physical therapy. So we've learned all these things at one point or another. And I think that's what's so great about physical therapy. You never know what you're going to get. You get more time dedicated with the patient, from my personal experience, compared to athletic training, where you treat one patient, you're on to the next one, or one athlete. So it's just kind of going. It's like a steady flow. And on top of that, these athletes are going or battling injuries in season, sometimes off season. So that can be difficult because maybe you don't feel that a patient or an athlete is fully back to where they need to be on the field, but the coach wants them back. So who really has a say? Usually it's the coach. The coach is the one that sometimes gets that call. And if they want their player back in 2 weeks, but it's a 4 week injury, you better figure it out. So you better come up with a good plan in terms of like, how am I going to get this person back on the field? With physical therapy, you have a little bit more autonomy, and you can take your time with certain treatment sessions. You can dedicate one session to gait training. You can dedicate one session to maybe improving hip and knee stability. You can dedicate another session to strength and conditioning once it's appropriate. That's what I like about the physical therapy aspect. There's different check marks that you're trying to, write off. Whereas with athletic training, it's a little bit more intense, but some people like that. I know that's a little bit long of an answer, but that's why I think they're both careers are awesome in the sense that you can really just pick and choose what you think is right for you. But it's best to get the experience because you don't want to get into it too far without really knowing what to expect.
Yeah, no, I agree with you. It's funny when people ask me like, "Oh, Danny, like, what should I do?" Because people know I did athletic training, so they'll be like, "Oh, like, should I do athletic training or physical therapy?" I kind of give them that like in a much shorter version. I'll be like, "Oh, well, listen, if you like being on the field, if you like running to athletes, if you like things like really fast pace, if you like the grind of waking up and traveling with a sports team." Do athletic training. But if you like something that's more rehab focused, where you're focusing on movement, something where you're specifically like more focused on the rehab side of things, where it's a little bit more calm, then do physical therapy. That's kind of like the short answer that I give people, to not give them a whole 10-minute conversation about the professions. But hopefully, after watching this interview, somebody could watch it and they're like, oh, okay, now I know what to do, or it kind of gives them a better idea. But is there anything else you want to say specifically, or you think we've covered everything?
I think ultimately, I know we harped upon the financial discrepancy, but don't let that be your main choice of why you choose one profession over the other. Think about it more in terms of like why do you want to do athletic training versus physical therapy? You have to be passionate about it. That's number one. You have to be willing to put in the work. Everything else comes with it. If you just go on an instinctive run and you want to do athletic training because you saw an athletic trainer on TV help somebody out with an injury, then maybe that's not the best way to get into it. Do your research, watch this video, maybe just ask other people that are in the field, and yeah, I mean, you really just need to do your research when it comes down to it. Don't let money be the issue. It should definitely be something to consider, but do what's right for you and be passionate about it and be willing to work hard.
It's good you mentioned the financial things because, I mean, I'm pretty sure you're aware of it. Usually, the athletic trainers that are like, at the top, like the head athletic trainers in the NBA, NFL, like they make pretty good money, probably even more than some physical therapists. And guess what? Those are the ones who actually have been committed for years, the ones who love what they do, who they might have felt burned out at some point, but guess what? They kept going, and that's how they got up there. Not only from a financial perspective, but also a career perspective and just a passion for what they love to do every day. So it's important to, at the end of the day, do what you love and be the best that you can possibly be, whether it's physical therapy or athletic training.
Definitely. I've never had a day where I got bored of my job. It's always fun and it's always a new adventure. And I think that's what's so great about physical therapy. I'm obviously not solely an athletic trainer, but I do love the memories that I made, all the people that I met across the journey, and the ability to, improve outcomes for patients and just get them back to where they want to be.
I agree. Ultimately, I think with either profession, you're still helping people get back into, how they used to be. So that's something that both professions have, which makes them amazing.
Sometimes better. Sometimes we identify things that maybe weren't addressed early on.
Exactly. But Alex, thank you so much for doing this interview. Hopefully, it helps a lot of people because, like I said, people have been asking me, and I think after this interview, it'll help people that kind of were on the line between athletic training and physical therapy. So thank you.
Thanks for having me. It was a great discussion, and I hope that we can change some people's lives and get them going in terms of their career choice.